The survey actually turned out to give some very surprising results. So in terms of all cancers, if you really broke it down, we found people that had high distress scores and low distress scores. The whole survey, if you kind of put all the numbers together, gave a rank score somewhere between 0 and 112. And it turned out that anything of 29 or greater was associated with decreased outcomes across all cancers. And this was validated in a tool and a presentation at this past ASCO. In terms of multiple myeloma, we found some very interesting facts. In terms of distress score correlating to outcome, there is a trend towards significance in that those with higher distress scores did have worse outcomes. However, that was not statistically significant. It had a p-value of 0.66. But there were some interesting things that did come out of our study. One was the depression modality. And the way that we approached depression was utilizing something called the PHQ-2, which is basically a 2-question screening for depression. And it basically asks about feelings of depression as well as feelings of anhedonia. And it turns out that although only 15% of patients reported depression, 41% of patients reported anhedonia, which is highly consistent with depression as a larger scale. So it's really interesting how patients actually report their symptoms, but ultimately what we really gain from this is that patients really give an insight to us in terms of when they're ready to transition towards palliative care, when they're ready to transition to cessation of chemotherapy. And one of the things that we're looking to develop this is how do we best treat our patients, and then also how do we benchmark physicians in terms of what the best way to manage patients is globally.